This is video number 25 in my health insurance bill coverage. We are now on page 25 of the healthcare bill. This is under section 1102, reinsurance for early retirees. Okay, so the people, they retire early from the company because the company either forced them to retire early, or they just simply decide that we've got enough to now go ahead and retire. They want these people covered. Okay, not later than 90 days after the date of the enactment of this act, which that 90 days is long since passed, the Secretary shall establish a temporary reinsurance program, okay, notice the word temporary, to provide reimbursement to participating employment-based plans. Okay, so what they're going to do is the employment-based plans are going to have costs for providing health insurance to early retirees. Okay, and this plan will give those employment-based health insurances money to help them insure these early retirees and their eligible spouses, surviving spouses, and dependents of such retirees during the period beginning on the date which such program is established and ending on January 1st, 2014. So between now and January 1st, 2014, if an employment-based plan has to cover an early retiree, then the U.S. government is going to reimburse them for some of the costs that they're going to have to incur to cover this guy. Okay. Reference in this section, health benefits. The term health benefits, they're going to define some terms for you. The term health benefits means medical, surgical, hospital, prescription drug, and other such benefits as shall be determined by the Secretary. Now, the Secretary, again, is the Secretary of Health and Human Services. Whether self-funded or delivered through the purchase of insurance or otherwise. Then they go on to define what an employment-based plan is. The term employment-based plan means a group health benefits plan that, number one, is mandated by one or more current or former employee. Is maintained by one or more current or former employers, including without limitation any state or local government or political subdivision thereof, employee organization, or a voluntary employees beneficiary association. Whew, that's a lot there. Okay, so these employment-based plans are maintained by former employers, okay, employee organization, which I guess the employees get together and they form their own health insurance. That's what I'm getting. A voluntary employees beneficiary association, which somebody's going to have to find down here because I have no idea what they're talking about. Or a committee or board of individuals appointed to administer such a plan, or a multi-employer plan as defined in Section 337 of the Employee Retirement Income Security Act of 1974. And if anybody would like to look up the Employee Retirement Income Security Act of 1974 and find this Section 3, Part 37, please do leave a video response below. I'd love to hear from it. I'm tired of looking these things up. Provides health benefits to early retirees. Whew. Then they define what an early retiree is. The term early retirees means individuals who are age 55 and older, but not eligible for coverage under Title, this is going to be Title 18 of the Social Security Act. So in other words, they're not eligible for Social Security, but they're over 55, and who are not active employees of an employer maintaining. So in other words, they're not working for this employer anymore. They actually did, quote, retire. Or currently contributing to the employment-based plan or of any employer that has made a substantial contributions to the fund to fund such a plan. So they are no longer contributing to this system anymore. These people are just reaping the benefits. So that's what an early retiree is. Wow. Participation in employment-based plan eligibility. A participating employment-based plan is an employment-based plan that meets the requirements of paragraph 2 with respect to health benefits provided under the plan. Submits to the Secretary an application for participation in the program at such time, in such manner, and containing such information as the Secretary shall require. So they meet the requirements of paragraph 2 concerning health benefits, and then they go on and they make an application to the Secretary of Health and Human Services, and the Secretary then approves them. Employment-based health insurance. This is the paragraph 2. Okay, this is where paragraph 2 comes from. As I was telling you, meets the requirements of paragraph 2. Well, this is paragraph 2. Employment-based health benefits. An employment-based plan meets the requirements of this paragraph if the plan implements programs and procedures to generate cost savings with respect to participants with chronic and high-cost conditions. So they find ways to care for these people but do it cheaply. Provides documentation of the actual cost of medical claims involved. So they have to the doctors and the hospitals, whatever, send the bills to these health insurance programs, and then these health insurance programs send all this information to the Secretary of Health and Human Services. And these programs have to be approved by the Secretary of Health and Human Services. So these employment-based health programs that are going to be covering all these early retirees, if they want money from the government, they have to do the following things. They have to submit the claims for reimbursement to the Secretary, which shall contain documentation of the actual costs of the items and services which each claim is being submitted. In other words, they can't make up a whole bunch of figures. They have to show these people the actual bills. Say, okay, these bills were given to us, now we're giving them to you. Basis for claims. Claims submitted under subparagraph A shall be based on the actual amount expended by the participating employment-based plan. In other words, the doctor in the hospital sends their bills to these employment-based health programs that are covering all these early retirees. The employment-based programs have actually sent checks out to these doctors and hospitals, and then they have to show the canceled checks to the Secretary of Health and Human Services, which will then reimburse these employment-based programs. Whew, that's a lot. Okay. If the Secretary determines that a participating employment-based plan has submitted a valid claim, so in other words, these employment-based programs that are covering all these early retirees, they've gotten bills from the doctors and the hospitals, they've made payments to these people, and they've put all this stuff down, and they've sent a big old letter to the Secretary. If the Secretary says, hey, these are valid claims, here's what he does. He shall reimburse the health plan for 80% of the portion of the cost attributed to such claims that exceed $15,000. So in other words, the doctors and the hospitals send bills to the employment-based health program that's now covering all these early retirees. The first $15,000 is the responsibility of the employment-based health whatever. After that, it's an 80-20. The Secretary will give you back 80% of anything you spent above and beyond $15,000 per claim. To be eligible for reimbursement under the program, a claim submitted by a participating employment-based plan shall not be less than $15,000. So in other words, you better not waste the time of the Secretary of Health and Human Services if you have a claim that is less than $15,000. And if the claim is greater than $90,000, don't even talk to the secretary. He doesn't want to hear from you. Isn't that nice? Well, what happens if these people bombard you with $150,000 in claims? Well, the employment-based program is just screwed. Such amount shall be adjusted each fiscal year based on percentage increase in the medical care component of the Consumer Price Index for all urban consumers, running to the nearest multiple of $1,000 for the year involved. And then this little thing right here tells you how these payments are to be used. So when the secretary says, hey, I think you got a valid claim here, I'm going to give you some money back. I'm going to give you 80% of this claim that you've given to me. But this is how you have to spend it. Okay, so when the government gives you back that money, you have to spend it the way the government tells you to. Amounts paid to a participating employment-based plan under the subsection shall be used to lower costs for the plan. So you can't just spend it any old way you want. You have to figure out ways to lower the cost of your program. Such payments may be used to reduce premium costs for an entity described as section A, or to reduce premium contributions, co-payments, deductibles, co-insurance, or other out-of-pocket costs for plan participants. In other words, you have to give a discount to these people who are buying into your plan. You can't just use it for anything. You have to give these people a discount for their future premiums or whatever. Such payments shall not be used as general revenues for an entity described as whatever. The Secretary shall develop a mechanism to monitor the appropriate use of such payments by such entities. Payments not treated as income. Payments received under this subsection shall not be included in determining the gross income of an entity described as whatever that is maintaining or currently contributing to a participation of employment-based plans. Now, at this point, we are on page number 27 if you're trying to follow along here. So, you can't say, you know, the Secretary has given you back 80% of what you just peeled out. But you can't claim it as income. Secretary won't let you do that. So when you're putting in the accounting books, you can't say, hey, we're a profitable health insurance company because we got this money back from the government. Can't do that. Government won't let you. Appeals. The Secretary shall establish an appeals process to permit participating employment-based plans to appeal a determination of the Secretary with respect to claims submitted under this section. So, the employment-based plan sends a bill to the Secretary. The Secretary says, no way, that's not going to happen. So, they have this appeals process, and they try to appeal to get their money from the government. Yeah, good luck with that. Okay, then there's procedures to protect against fraud, waste, and abuse under the program. Alright, then there are audits to this thing. The Secretary shall conduct annual audits of the claims data submitted by participating employment-based plans under this section to ensure that such plans are in compliance with the requirements of the section. So he's going to make sure that when you're submitting these claims, when this employment-based program submits a claim to the government, that it's all legit, so on and so forth every year. He's going to audit this thing. Alright? Where's the funding coming from? It's coming from the Treasury. It's coming at about $5 billion. Okay, so there's another $5 billion appropriated to get this part done. And the Secretary has the authority to stop taking application for participation in the program based on availability of funding under the subsection. So, yeah, these employment-based programs, they want all this reimbursement for all these early retirees. Well, if things get so bad that the whole $5 billion is about to disappear, the Secretary can say, hey, you're not going to participate anymore. You can't submit any more claims to me. You're done. It's finished. So the employment-based program gets screwed anyway. And of course, if they get screwed, you're going to get screwed. I promise you. Now that pretty much covers the early retirees. Hope you enjoyed that one. I thought that was thrilling. Okay, I will cover more in a future video, so stay tuned.